everyone, my name is Helena. This is Ali, our general medicine students of the 5th year from United States. We would like to introduce you our medical faculty of Maastricht University. We would like to tell you something about the admission process, study system, and living in Brno. First of all, we would like to tell you what medical faculty offers. Currently, we offer 2 programs in English language, general medicine and dentistry. Both programs are for self-payers. General medicine costs yearly 1,500 euros. Dentistry programs cost about 12,000 euros per year. General medicine program lasts 6 years, dentistry program lasts 5 years. To be accepted in those 2 programs, everybody has to pass the admission entrance examination test from 3 subjects, from 3 courses, chemistry, biology, and then everybody can choose between physics and math. To be accepted, you have to pass all 3 tests together for better than 60 and 65% for dentistry programs. How to be accepted? On our website, med.muni.cz, in January, from the 4th of January, will be open electronic online application that you will submit with all required information, and you have to apply via our representatives abroad. The list of our representatives in individual countries is also provided on our website in the information for applicants. We already set several exam dates. All exams will be provided, let's say, in person. Of course, if the epidemiological situation will get worse and will be changed within Europe and the whole world, we are ready to organize the examination test also online, as we did this year. How to help you? On the same website, we provide the syllabi of each course and as well the sample tests from the last years. Also, because we really want to help you and want you to help be well prepared not only for the entrance examination test but also for the first year of studies. You can purchase e-learning preparatory courses from chemistry, biology, and physics, provided each course costs 100 euros, and you can study in the comfort of your home under the supervision of our teachers. For those of you who probably do not have so much skills and knowledge from the science, or unfortunately failed in the entrance examination test, our faculty offers the foundation program. It's a 6-month program that will prepare you not only for the entrance exam, also for the first year of studies. You will be taught courses like chemistry, biology, physics, math, a bit of histology and Czech language in the same facilities as the medical students are studying. I suppose for the admission process, these are the basic. If you need any other questions, or if you want to need anything, you can send us your questions in the end of this stream. Now, I would like to ask Ali if he says something about the studies and living in Brno from the point of the student.
Thank you. Thank you. If I could just introduce myself first. My name is Ali. I'm a 5th year medical student at the Faculty of Medicine, as well as the former vice president of the Maastricht International Medical Student Association, and as well as the American student ambassador here. First of all, I just want to thank you guys for having me. It means a lot to have something like this happening in the university, because I think it really makes people a lot more comfortable when they're considering which university they would like to go to further progress their studies. I'm here to talk about life in Brno, why I chose to come here, the studies here, the Maastricht International Medical Student Association, the Ambassador Program, and furthermore on the accommodation and visa process. So why I chose to study here is because I was studying in high school in the Middle East, and although I was accepted into programs in the United States, it was much more expensive and a lot longer than it would have been had I went there instead of here. After searching around, I realized that the financial burden of coming here was a lot lower, and the study period was a lot shorter, where it was 6 years here compared to the 8 to 10 years that I can take in the United States. And that is why I chose to enroll into the general medicine program. Studying here, just as a general overview, I'm sure they will elaborate on that more, but it's a 6-year program with 3 years for preclinical and then 3 years for clinical. Life in Brno is very unique. Coming from a big city like myself, if you're like me, I think you'll find a very big transition when you choose to come to Brno. It's a very small city with a very tight community.
It's not so small, actually.
I'd
Almost
say
half a million population, guys. I suppose it's not so small. It's not a village at all.
I agree. I completely agree. I'm saying more so compared to these big cities that people are used to, that some people might be used to living in. And the reason why I'm saying it's small is in a positive way, because I think that when you're studying something so rigorous such as medicine, having all these things close to you is an amazing convenience. I live in the center, for example, and right outside my house, I have a shopping center. I have restaurants, cafes, bars, and clubs, and anything that I might need is accessible within 200 to 300 meters. So yeah, there's many things to do in Brno. If you would like to have restaurants, there's many international and local cuisines. There's stalls if you want to go to the vegetable markets, food trucks, cafes if you just want to hang out with your friends. And like I said before, if you're interested in the nightlife, there's plenty of clubs and bars that you can attend. I think now I would like to take the opportunity to somewhat show you a glimpse of what the Faculty of Medicine looks like. It's a very big campus, and so we're just going to show you bits and pieces and give you the most relevant information. I believe now we can take it to Dr. Jokal and Nir at the Anatomy Museum.
Thank you, Ali. My name is Nir Yavin. I'm a second-year student in the Faculty of Medicine. I choose to study here because for me, technology and innovation stands at the very core of medicine. And we are broadcasting to you from the Anatomy Museum. Last summer, I graduated the anatomy program in the Faculty of Medicine, and this year I'm serving as an assistant in the department. And I am very excited to introduce you Dr. Jokal, that will show us the innovation and the technology in the campus.
Thank you very much, Nir. It is my great pleasure to welcome you to the Department of Anatomy in our great anatomical museum that is dedicated to Professor Karel Žlábek. What I would say is that the Anatomical Museum is one of the most representative part of our department. We have here now approximately around 1,000 anatomical specimens that are organized in different systems. And it is just with big benefits that our students may use it also during their studies. When they have free time, they can come here to study and see the anatomical specimens. Now just maybe a couple information about the organization of the anatomy here in Brno, because the anatomy is one of the most exciting part maybe in the study of the medicine, and it is in the first year. And of course, this is very hard examination for our students because they have to absorb approximately around 2,500 to 3,000 anatomical structures. They have to know the relations. So I will tell you how is it organized. So when you apply for the general medicine, the anatomy is of course, as well as for the dentistry in the first year, we have 2 semesters of the anatomy. We use the, let's say, just some traditional methods combined also with the modern technique. Now we have here amazing simulation center that I will show you also, and our methods that we are using. But from the traditional methods, the first semester when you will study, you will have a look on the locomotor system. We have the seminars where you work with the real human cadaver specimens. Those seminars are, of course, also just based also on the theoretical knowledges that you will acquire in the lectures. So at the end of the first semester, our general medicine students have to complete the dissection course that is focused on the dissection of the limbs, upper and the lower extremity, and the back. Um, our university, our faculty is just very unique in the way that we use real human cadavers. Our students are practically dissecting. So it's not just only a demonstration, such as is in also other universities in the Europe, but here our students dissect the bodies and they find the structures themselves. So this is some traditional way of teaching. Then during the first semester, our students of the general medicine, they have also practicals in the simulation center that I will show you later on. And also what we are doing right now, and we have a new concept of teaching of the anatomy. We also use the USMLE based tests that are for some progression tests that give feedback to students if they study well or not. If they are successful and very good in the studying of the anatomy based on the results of the USMLE test, they may also acquire or get the grade from the anatomy without any needing of the oral examination. In the second semester, I just forget to tell you that we continue after completion of the first semester, the locomotor system with the organs and the neuroanatomy. In there, it's very hard and complicated part of the study of the anatomy, and there will be, for the general medicine students, more practicals in the simulation center. In total, 3 courses that are focused on the imaging methods and the regional anatomy of the head, neck, chest, abdomen, and the pelvis. At the end of the second semester, the students, both from the general medicine and also from the dentistry, they have again the practical course, the dissection course. For the general medicine, it's 2 weeks of the dissection, in total 40 hours in spring, where they dissect the head, neck, chest, abdomen, pelvis, and all organs. Again, it's just they dissect it themselves. So it's not a demonstration, they do it themselves. And after this, they have the practical examination. The dentistry students, they have the dissection course that is focused, of course, on the head and the neck. So they have the dissection for 20 hours. So it's 1 week in the second semester. So I explained to you now the organization of the semesters and the teaching of the anatomy. But of course, the most important thing for us as the teachers, and maybe also for you as potential and future students, is that of course after completion of all chapters, you have to do the final examination. As I said just before, the excellent students from the general medicine program, if they are successful in the USMLE tests, they don't need to go for the oral examination. But basically, the oral examination is just focused on the whole anatomy, where we, of course, examine everything from the human anatomy, because of course the anatomy is a basic for also other subjects such as the surgery, internal medicine, and so on. So, and now I would like to just show you the simulation center and our new way of teaching. So of course I need some time to move there to show you our virtual autopsy table. So thank you very much, and I'm now just giving word to Helena and to Ali back to the studio. Thank you.
Hi again. Pardon, hi again.
Thank you, sir, for that. I just want to give you a brief overview of how the medical program actually works. I know I mentioned it, very lightly, but now I'll just kind of tell you how it's structured. So, of course, as I said, it's a 6-year program. There's 3 years of preclinical studies, which is where you learn the theoretical basis of what it takes to be a doctor. And after that, once you get into 4th year, you start your clinical studies. And this mostly takes place at the faculty hospitals. One of these is right next to us, where we are at campus right now. The other is near us at Pekarska. And of course, there's various small little departments such as oncology and trauma that are scattered throughout Brno. And I believe you wanted to mention something about Erasmus during the clinical years.
Yes, that's true. As Ali said, within the 4th and 5th year, students participate in a clinical tuition. It means that, for example, as a 4th year student, you spend 2 weeks in a surgery clinics, another 2 weeks in the week in orthopedic. Actually, that's why the program is called general medicine, because students will get the knowledge of the general field of medicine. In the last year, the 6th year, we called it the years of internships, when students have to pass several weeks of internal medicine, several weeks of surgery, and after all these blocks, everybody have to pass the final state exams. Passing the 4th state exams, everybody became a doctor of medicine. Within those clinical years, students can participate in the Erasmus exchange programs within the Europe, and also our medical faculty has several agreements between hospitals and universities outside of Europe that students can participate and spend the years or the weeks of the blocks and internships abroad. I can mention briefly several hospitals currently in United Kingdom that our students can get the experience, and if they successfully pass those offer of the job there. So everybody who wants to get the experience abroad can apply within those exchange program and get this skills. Also, after each year, after the 1st, 2nd, 3rd year, students have to pass the summer practical training. That the summer practical training is possible to do in our faculty hospitals. Also, you can, our students can do this practice in their home countries. What else? Ali probably should mention the other part of our faculty life, which is out school activities. He will introduce you what means MIMSA. It's our Medical Students Association. Please.
Okay, thank you. So, one of the big reasons I'm here is, as Helena mentioned, to introduce MIMSA, which is the Maastricht International Medical Students Association. We are a board of around anywhere between 10 to 15 people, and we basically act as the connection between the students, which is you, and the faculty members. We have many different departments, some of which are preclinical education, which basically focuses on providing you with lectures and workshops that you need to strengthen your theoretical knowledge. And then we get further into clinical education, where we provide activities such as blood taking, suturing, and lots of different interactive hands-on activities, which is really, I think, important in order to enhance the practical skills that a doctor needs to function in the future. And as you mentioned, lots of outside of medicine events. They're mainly organized by our social team. For example, the orientation week, which traditionally takes place the week prior to the beginning of the first semester. And this is essentially where we throw parties, we kind of ease you into the life in Brno. We take you on tours. And I think it's a great way for anyone considering Maastricht University to participate in the orientation week, because you're able to socialize with new people, and you're able to kind of settle into the city. Just some other departments, for example, we have the charity department, where we currently raised $36,000. I mean, 36,000 crowns for a charity, not dollars. And lastly, the welfare department, which isn't quite new, but very important. It focuses on the mental health awareness for students, and basically focuses on connections to either therapists in Brno or events that are focused around self-awareness and things like that. Quickly, before we move on, I just want to touch on the second student system we have here, which is the ambassador system. As I mentioned when I first introduced myself, I am the American student ambassador for the Faculty of Medicine, but we also have many others. We have one from the UK, the United Arab Emirates, Spain, Portugal, and Germany. Those are just some examples that I can think of, and I'm sure there's plenty more. But if you are from one of these countries, please don't forget to take a look at the website. And if you have any questions that may pertain particularly to someone from your country, then please don't hesitate to reach out to us. That's why we're here. And we're more than happy to help you with any questions or concerns you might have, because we've all been in this position before, and it's a great opportunity for you to learn a lot more about Brno before you choose to come here.
Yeah. Thank you, Ali, very much, because you are absolutely right. Each country has a specific conditions regarding the entrance examination tests, not only, but also completing the high school diplomas, admission conditions, and, for example, visa procedures that we will mention later. As we mentioned, the campus is quite large. All the students are studying mainly in a campus within the first, second, and third year. Anatomy department has been already introduced. Now we would like to show you the heart of our campus, which is the library. And I would like to ask Maria and Margarita to show you around our library and explain you how it works inside.
Hello guys, welcome to this virtual trip. My name is Margarida Barbosa, I'm Portuguese, and I'm on the 5th year from General Medicine in Maastricht University. I'm here to show you a bit of the university campus library. There is like a big library. As you can see, you have a lot of lights, it's pretty new. You have a lot of tables and space where to study. And the students come here and they can choose which place suits them the most to study. You have either this big area, and you can come with me and I will show you the other types of room that you have. You also have like these bigger rooms that are more private, where you can either revise with your colleagues or study in group. Then you also have some individual rooms in case you want to study by yourself and be more quiet. Also, you have, if you want to bring your laptop, you can use the ones that we have here. We have like some computer zones, like this one upstairs, where you have plenty of laptops and also printers that you can print the notes that you need. Also, you have and you have more computers around the library. So the students come here and they can choose like whether they use it or not. Then you have like these big bookshelves where you have a lot of books. You have it for the different subjects that you need, and they use a special system that it uses colors. You have the instructions and the different subjects written in these small like panels. So the color system means if a book have like this green mark, it means that you can loan it for 3 months. You can take it home for 3 months. Then you can have the one, if the book have like the blue mark, so you can just take it 1 month, during 1 month to your place. And if they have the red mark, you cannot take it home, but you can use it as long as you want here in campus to study. So just come with me, like we go through these shelves where you have like books from anatomy, physiology, all the subjects that you need during the course. And like, of course, the library is not the same now because due to these epidemiological conditions, the students cannot come here. But usually this is full of students that are like trying hard to pass the subject. And this is pretty much what you can see in the library. It's like a big space. And then you can come with me because we'll show you another part of the university. Also, what we have here is like in many parts of the university, you have the adequate protection measures due to COVID. We have like alcohol, and in the entrance, you just disinfect your hands, and that's it. That's all from me, guys. Thank you so much for going with me in this trip. And now I'll pass you to my colleague from Spain. And
hello. Hello everyone, my name is Maria, I'm from Spain. I'm a 5th year medical student. You can come with me. Today I'm going to show you the bookshop, and I'm going to show you also the canteen, which is located in the middle of the campus. As many of my colleagues, I always wanted to study medicine, and due to problems in life in high school, I couldn't reach the mark back home in Spain. So I checked some main universities in Europe, and Masaryk University has a really good rate. So I did an entrance exam in this university. I got accepted, and here I am. So if you're in a situation similar, always think that there is a plan B, that you always can come to a university located in Central Europe. So here we are in the second level. Here we have a small canteen. This is a small canteen. You can see. This canteen has daily menus, and you can always come if you just have half an hour between class and class, or you have a small break, or you just want to eat something fast. They have the food prepared, so actually you just need to ask it and they will give it to you. It has really affordable prices. And well, this is not the only canteen that we have. Actually, we have like a food court, which is like 3 minutes walking from here. It's located in a shopping center that is like connected with the bridge with our university. So don't worry, guys. We have a lot of food. We will be eating all what we want. So here we are. We are in the bookshop. In this bookshop, yeah, the ladies are working. Let's enter. Let's go with them. Follow me. In this bookshop, we have all necessary for our degree. Here we have the white coat. Also, we have shoes. This is all the material which is required for the anatomical class, for also for clinical practices in the hospital. So don't worry about anything. You have all the material you need here in the bookshop of the university. Here you have like a lot of material to study, like you have books, pen, like notebooks, whatever you can need, you will find it here. As you can see, we have plenty of books about different topics in medicine. if you are more curious or you want to have like books related with other topics that you're interested, always in general medicine, physiotherapy, or dentistry, you always can find it here. And here you have the white books which university provides for the students for them to prepare in their classes. Here we have the white books, which are recommended for the entrance exam, because basically they cover all the topics that will enter in the entrance exam. So actually, it's like a really good thing, like to study from them. You need to know that if you want them, you just need to message the university, like send them an email, and they will explain you like the way how to do it, and they can send it to you online. So I think that's everything from me, guys. I forgot also to tell you that I'm the ambassador from Spain. So if you have any doubt, if you have any problem, or you want more info, you just need to contact me or contact the university. So it was a pleasure from me, and I hope you have a nice day. Adios. Gracias.
Thanks, Maria and Margarita, about the introduction of our library, and also about talking about the canteen, food and catering. Now Ali will tell you about the accommodation in the city of Brno, because I suppose everybody also wants to know where you can stay during the night. Please.
Okay, so there are two types of accommodation in Brno, right? One is obviously the student dormitories that are provided by the university, and the second is the private accommodation. That is basically you renting out your own apartment, either by yourself or with a couple of friends. Now, mostly in first year, my personal student recommendation would be to stay in the dormitories. They're very cheap, very affordable. The facilities that are provided by dormitories such as Vinarska and Domek, just to name a couple, they're very nice. It's a very nice place, and it kind of keeps you focused, because you're around students all the time, and when other people are studying, it's kind of a reminder for you to get back into the swing of things. And obviously, I should mention that the social life in the dormitories, is not something that you'll miss out. Very enjoyable and memorable experience for anyone that lives there. I lived in dormitories my first year, but then after that, as I did, you're able to move out into a nicer place with several people. I have 3 roommates myself, and I think that it's very nice and convenient once you get into the clinical years to have your own apartment, because you can travel to different locations in the city. You're living in the city center sometimes, you don't have to, but if you are living in the city center, you have access to a lot more services and facilities that are offered by the city. And that's why I recommend anyone that is looking, or if they're a bit comfortable in the uncomfortable in the student dormitories, to definitely have a look at the private accommodation. And there's plenty of agencies that can help you out if you need something.
I absolutely agree, because I think it depends on the priority of each of you. Someone really wants to be socialized among the many people. Some people like, for example, to live in a more privacy, and most of our students, they like cooking of themselves. So it's always better. I suppose staying in the dormitories for more than 2-3 years. It depends. Dormitories might be, I would recommend for 1 year, 2 years, definitely for the Erasmus students, but 6 years of studies, live in a dorm, I suppose.
It can get tough. It can
be tough.
It can be tough.
You should really realize that medicine is a full-time job.
More sometimes.
Yeah. And you really need your time and for studies. By the way, how many weeks did you study for the anatomy exam? Do you remember?
Yeah, so I only remember this because we talked about this during the orientation week. But when you asked, I remember that it was somewhere around 3 months that I properly put into the anatomy exam in the first year. And when I say 3 months, I'm talking about proper, let's say 6 to 8 hour days of studying. before that, I'll be my life every day. I was still, focused on my course, but rigorously, of course. So during the 3 months, it was definitely,
Yeah.
just goes to show how much work is required to survive in this university.
And how many kilos up to do?
I actually lost a lot of weight, because you don't have time to cook, and sometimes you just feel like you should study rather
I
than
heard
eat.
about the pizza effect,
Yeah,
that you
it's
are just
crazy.
waiting for the pizza
It's
delivery because
actually
you have no
crazy.
time to go out.
Yeah, exactly.
Okay, I realized that I forgot to mention some details for the admission process. After each entrance examination test, you will get the results within 5 days. You will know in the online application and via the email if you are accepted or not. You will get the official letters. Students who are accepted will obtain the package of the admission documents, including the invoice for the tuition fee payment, and also the password and login into our system. Everything in Maastricht University is doing online. And also, because we spoke about the accommodation, you will get information on how to register online into our dormitories. And also, you will obtain the invitation for the orientation week that already mentioned Ali. He forgot to say that in the end of the orientation week, the medical faculty, together with MIMSA, we organized the barbecue, the big barbecue party, where also parents are invited. What we should mention is the visa procedure. After you receive the documents for the admission, you should immediately start your visa process. Ali will tell you why, because you are skilled.
Yeah, definitely. Since I am not a European national, I was required to, get a visa and extend that visa every single year that I've been here. So, and it's a very long, and it can be a very drawn out process that is really tiring if you're not on top of it. So, I think most relevant information for you would be that, if you do choose to come to Brno and you do get accepted and receive the documents from Maastricht, then I highly recommend you the first priority of yours is to actually submit and receive your first long-term visa. Because there's lots of documents that need to be submitted for that. It's really no joke. Just to name a few, I believe you need your high school transcript, official high school transcript, criminal records.
Yeah.
A lot of times, actually, I'm 90% sure you're still required to submit an accommodation contract of, where you'll be staying.
Yeah.
And, because of these requirements, it's really important that you plan out ahead of time and kind of figure out what you need to be doing at what point in time.
Yeah.
So definitely, I'd recommend starting on it as soon as you get accepted.
That's why maybe I would recommend you to use the services of our partners, that they know what documents or whatever is required for the visa procedure, in order you do not lose appointments. Because if you do not have all completed documentation with all necessary issues, the embassy, our embassy somewhere will refuse your application, and you have to start again from the scratch. Yeah. Well, I think the next segment is of our stream is the second part of the anatomy. Dr. Jokal will probably know that sooner we opened the new simulation center, probably the most modern in the whole Central Europe. And anatomy as a subject, as a course, of course, the other courses, it's taught in this simulation center. Now I would like to kindly ask Dr. Jokal, explain the system of teaching anatomy in a simulation center.
Okay, so thank you, Helena, for introducing the Okay, so thank you for introducing this part. So now I just would like to invite you to our three-dimensional virtual autopsy table, show you the anatomy and our anatomy lab. Now we are in the fourth floor of the simulation center. Just come in. I will show you around what we have in here. So as you may see, the lab, the anatomical lab in here is just divided to the section where we have the groups of students working together on just some cross section on the imaging method. We have, of course, here the on both walls in here and also on the other side, the screens where the students may see what happens on the virtual autopsy table, what are doing the students that are working with this. So now I can show you what is the major aim of this practical part here in the simulation center. You may see that we have here, first of all, the real cross sections of the real human body that was just taken in the full HD, and you can see all the anatomical structures that are in there. For also better orientation on the table, we have here just the macroscopical specimen where just is shown the plane where the cross section is done. And the major thing, what is the reason why we have these practicals in here, is here the picture from the imaging method. This is just the CT, the computerized tomography image, because from my point of view, the major impact of the anatomy for our students to the future years for their studies is to be oriented in the anatomy of the human body, mainly in the imaging methods. Because it doesn't matter if you would be neurosurgeon or internal medicine doctor, always you need to be oriented on those cross sections. So the way of teaching here is just to be oriented in the regional anatomy of the human body on the imaging methods, using also the cross sections that are of the real specimen. So for our students, we have prepared just 6 cases, 6 images, and we define the major structures that they have to be able to show us on the image. So I will show you now how we are doing this way of teaching. So basically, when we start, when the group of students start working here, I'm just asking them to, first of all, orientate on the image. So we have here nicely visible the posterior side of the body, the anterior side, lateral, and the medial. So when the students are oriented, they are asked to find the just approximate plane where the cross section of the imaging method has been performed. So we can see here that we have here just nicely visible the gluteus maximus. We have here head of the femur, so-called the greater trochanter, that is for the attachment of the muscles. So we need to see approximately the same thing also on the real cross section. So the students may just use here a button to move with the cross section, with the image, to find a proper level. So I will try to identify the head of the femur and the trochanter here, just approximately like this. What is just big benefit of this table is that when you touch the structure, because students should do it themselves. Yeah? So only the teacher is something like the advisor, not just to teach them, okay, here you can see this and this, but the students should be able to work alone. So they can touch here, and it's written here, the gluteus maximus, yeah, so the muscle. So when they have it on the cross-section, on the real cross-section, they may also have a look where this structure is localized on the image. So I will now just point the same structure. So this is the gluteus maximus. So this way, of course, we just continue also to the other parts of the lower extremity, because the lower extremity is in fact the second practical in here. The first is just about the upper extremity, so the regional anatomy and the imaging methods of the upper extremity. So I can now maybe move to show you the another image of the cross section through the thigh. Yeah, so that is in here. So when we just set up this image, then again, students should find the similar position. What I know from here is that we are in the upper or the proximal part of the thigh. So what I would like to do is to find again the similar plane. So I will move. I know that it should be caudally, approximately in here. Yeah. Just a little bit more. Okay. Right. So we have again the cross section. So what I would show you in here on the second one, we can be focused on the so-called femoral artery. Femoral artery is just a major artery of the lower extremity that brings the blood for the lower extremity, so it's necessary to see it. So on the picture on the plane, on the cross section, you may see it nicely on the ventral aspect. So because we have here the CT angiography, so-called, because this is the method where we inject, or to the patient is injected the contrast agent. So I can see just some very whitish dots in here. So it should be filled with the liquid. So and I know that this structure here is more superficially. So this is the femoral artery. Here I have the deep femoral artery that is a branch of the femoral artery. So the students, when they are oriented, they know what is ventrally, what is anteriorly, what is posteriorly, medially, and laterally. They can just easily, again, point the femoral artery on the cross section. What I would like to add to this is that the cross sections, the images from the CT and MRI, they are a part of the USMLE tests. They are also a part of the final examination. So this is just one of the aspects of the anatomy that is not taught in any other institute, in any other faculty. So at least in the Europe, and I would say also in the world, because the cross sections through the human body are just very hard to prepare, the frozen cross sections. You will see when you will be accepted for studies here, and you will have the anatomy, that we prepared the real specimens, the real cross sections that are also a part of the practices for the simulation center. Last thing I would like to add is that we have prepared all materials for the anatomy. Online, we prepared all commented videos for the students, so they can study anytime from the lecture that I have. I'm just explaining all the structures in there. This is also one of the unique things. So this is not the traditional way of teaching that you as a student is sitting in the seminar room and me as a teacher is just explaining. We use online tools for teaching, so to prepare the videos. And personally, I hope that our students will just use it for the final examination and they will be passed, at least in the Europe and hopefully in the world. So I would like to thank you from here to just be a part of this stream, because this is my last presentation of the anatomy here, and I really look forward to meet you in person. Thank you, goodbye, and I am giving word to Helena and to Ali to back to the studio.
So we received one request regarding the dentistry program. The admission for the dentistry program, it's the same as for the general medicine. So 3 multiple choice tests from chemistry, biology, physics, or math. And the total number of points must be better than 65% to be accepted. Yeah. Regarding the dentistry program, I already mentioned that it's a 5-year program. The first 2 years, students study the same general medicine courses like the general medicine students in the campus. It means biology, chemistry, anatomy, physiology. Plus, of course, since the first year, in the curriculum, as we are talking about the simulation center, the whole floor. After the third, fourth, and fourth at the patient faculty in a sentence hospital in a city center. But the main of the courses are provided in a simulation center, in a, how we can say, dental simulators. We call it phantoms. Therefore, we would like to show you some kind of distribution. I would like to ask Lenka. She's currently in a dental simulation part, and she will show you how it looks like. Pardon.
Hello. Hello, everyone. Welcome to the Simulation Center. Let me allow you a little sneak peek into our dentistry program. If you are considering becoming a dentist, this is probably the place where most of your or some of your practical classes will take place. The Simulation Center offers high-tech and modern facilities for our students. Let me interrupt one of our students, Mickey, who can briefly explain us what is he working on.
Hi guys.
Hello.
So today we are prepping for a crown, the first and second premolar teeth, and the first molar teeth. You can closer, can see. You can come closer if you want. My first time, so cut me some slack. Crown threads.
Wonderful.
Thank you.
Interesting. Thank you. Thank you, Mickey. And we hope you enjoy the rest of the stream. Dentistry and Stomatology Unit is signing off. Bye.
Hi again. I suppose that's most of the things that we could say.
I think so. Yeah.
If you are interested in study at Maastricht University Medical Faculty, we will be very happy. I think we have a lot of things to offer. You have a lot of things to do while you are studying in Brno. And if you have any questions, requests, you can contact us.
Yeah.
Directly ambassadors also.
Yeah. So, just to close off, thank you for your time. Thank you for listening. On behalf of myself, and I'm sure on behalf of the new team at MIMSA and all the ambassadors, if you have any questions, please don't be afraid to reach out. We're more than happy to help you. So yeah.
Okay. Goodbye.
Bye.
Ciao.
Thank you so much.